Let's also have a bit of gap among us. Ahmed Lamin Samate and Honorable Mambura Njai. You know, today we have two ministers here. That shows the collaboration that we have been promoting and we're talking about. Today you will see the two ministers of health and finance to be talking to you and giving an update as to what we are doing with regards to COVID-19. So I now have the honor to invite Honorable Ahmed Lamin Samate to deliver his statement to the press. Honorable, welcome. You need the word.
Thank you very much, Mr. Njai. Thank you very much. Good afternoon to you all. The 27th National Situation Report since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020. Today marks exactly 1 month when the country reported the first case of COVID-19. Since then, the Ministry of Health has been working with partners to identify or to intensify COVID-19 response, and amongst the many responses and amongst the many achievements are the following. 9 laboratory test results were recently received. 8 of the samples tested negative. 1 of them is the result of a repeat test of the 4th positive case, and this test has come out inconclusive. 5 additional people were taken into quarantine. 2 of these are Gambian military officers who came back from travel recently. 1 is a Senegalese national who was intercepted at the Jiboro border post whilst trying to sneak into the country, and 2 are Gambian Quranic students coming from Senegal. With the brief lull so far in the reporting of new confirmed cases, there is a significant reduction in the number of calls to the 1025 hotline. Currently, the country has 6 active cases and no probable case. Just as a reminder, globally, since 31st December 2019 and as at 16th April 2020, a total of over 2,193,000 cases of COVID-19 have been confirmed so far. Of these, there have been well over 140,000 deaths, getting close to 150,000 deaths. There were over 550,000 recoveries. Senegal has so far recorded 335 confirmed cases, 194 recoveries, and 2 deaths so far. Currently, we have 72 people in quarantine. A total of 316 tests were conducted. Out of those, 9 were positive. 254 people completed quarantine. 241 contacts have been traced, and 310 people completed follow-up. There has been daily coordination meetings which are ongoing at both the strategic and technical levels to coordinate and implement our strategies for the response against COVID-19. The Ministry of Health is intensifying testing for the coronavirus in the country. Various communities and people in high-risk areas will be tested going forward. Individuals are equally encouraged to come forward to be tested. There has been increasing evidence that the use of the face mask has proven to be beneficial in the prevention of the spread of COVID-19. Countries in which the use of the face mask is widespread have had lower number of COVID-19 cases so far. This has gone to strengthen our conviction that in the Gambia, where the number of cases is low, the use of the face mask will help to protect both the wearer and the people around from infection with coronavirus. We therefore strongly recommend the use of the face mask for everyone going outdoors. The Ministry of Health encourages the use of locally made face masks for the general public since the surgical face masks are not readily available. Locally made face masks have proven to be effective, and as such we encourage the general public to regularly wash these locally made reusable face masks and to handle them with clean hands to avoid contamination. We hope to demonstrate this to you very soon after the Honorable Minister of Finance's statement, and after the question and answer session, we'll demonstrate and show our encouragement for the use of the face masks in this country. We thank you very much for your kind attention. Thank you.
Thank you, Honorable Ahmed Lamin Samante. I now invite Honorable Mahmoud Njai, the Minister of Finance and Economic Affairs, to also give a statement.
I thank you very much, Mr. MC. Good afternoon to you all. This is the first time we are appearing. We hope that every week we will come to the press and update you on the finances of COVID-19. Everybody is aware that the President did approve 500 million specifically for financing COVID-19. Prior to that, we released 12 million. That was the immediate release just to make sure we respond to COVID-19. As at now, April 16, we have spent 143.3 million. The 43.3 million was spent here in the Gambia, and it includes, the expenditure includes hotel, food for quarantine patients, purchase of various medical consumables. The balance as at now, out of the 512 million that we have spent, as of April 16, 512 is 368 million $23.7. That's the balance. Now, I think it is very important for me to clarify that up to this morning, every dalasi or butut spent on COVID-19 is from our local funds. Not a single dollar or penny has reached the source of Gambia. Yes, it is true that the IMF did approve on March 23rd a financing for balance of payment support of $47.1 million US. And this for $47.1 million is specifically for balance of payment support. It's the augmentation of our reserves, just in case we have a deficit so that they'll be able to fill the gap. That was the approval on March 23rd, 2020, meaning those funds will not be remitted to the coffers of the government of the Gambia. April 15, the IMF did. The first approval is called the Extended Credit Facility, ECF. The second one on April 15 is $21.3 million US. That is under the Rapid Credit Facilities. How does this facility work? It will be sent to the central bank, and the central bank will on lend. They will denominate it in dollars, and it will be on lend to the government of the Gambia. But all of these funds, up to this morning, did not reach the source of the Gambia. So just for clarification, it's been approved, but not yet disbursed. It is in the process. But the one that will reach the Gambia is the 21.3 million, and this is the update. Let me go back to the local funds. The Minister of Health and I constituted a committee comprising of the Permanent Secretary, Minister of Finance, Permanent Secretary, Minister of Health, Director General Public Procurement Authority, Director Internal Audit, the Accountant General, I believe, and there's a committee, very strong committee, that will vet every submission or request being made for the expenses to cover COVID-19. We have delegated them the responsibilities. So just to make sure that the process is expedited. So remember, every amount spent, the $43.3 million is local expenses. The $100 million that we also, that we spent is to supplement the World Bank $10 million US. That it's a grant, but there was a deficit financing of $2 million. That is for the purchase of medical equipment and consumables. So there was a deficit of $2 million. So out of this $512 million, we took $100 million. Now it is now $12 million, $10 million from the World Bank, $2 million from our own local sources. So just to re-emphasize the fact that up to this minute, we haven't received any money from outside. Basically, that's the update. And so far, I think I have covered everything, Honorable Minister, and I'll be available for any question and answer.
Thank you, Honorable Mambura Njai, for that update on financial matters related to COVID. I now invite Abubakar Sankano to facilitate the question and answer session. Sankano.
Thank you very much, Director of Public Health Education and Promotion, Mr. Modunjai. Thank you very much, Honorable Minister Dr. Samate, Honorable Minister of Finance, Mambura Njai. It is indeed a sigh of relief for you to be here, because we in the front line, we are tired of this 500 million. Thank God, for helping. And Honorable Minister, it's 1 month, as you say, but hyperbolically it has been like 1 billion years. But 1 month of disruption in our social lives. Thank you all, ladies and gentlemen of the COVID-19 Media Corps. The floor is open. Your name, media organization, and one question, and to whom the question is directed, please.
Honorable Minister for Health, today marks exactly 1 month after the Gambia confirmed first case of COVID-19. So far, 9 cases and 6 active cases are undergoing treatment. So looking at the trend, where does this place Gambia? And then there is, in addition to that, there is an expert view from the National Assembly that there are chances of Gambia registering up to 181,000 cases. Is this going to happen? Will Gambia be able to face this? And just a quick one to finish with you is we want to know also, as a media, who is responsible for communicating to the media on regards to these COVID-19 coverages, so that we can minimize the risk of taking chances of, misinformation, especially with regards to press conferences and other information that is valuable. Can I just ask the Finance Minister quickly?
Maybe when we finish. So
one at a time. Okay. I hold on for that question for the Finance Minister,
yes,
please.
Thank you very much. Of course, the Gambia has registered 9 cases for now. That's why we keep on emphasizing that we should not be complacent. We have seen the trend in other countries. Now, this is a new disease. Based on the pattern of epidemics, based on the pattern of this disease, how it manifested in China and how it is manifesting in the other Western countries. Based on those, there have been various models devised by various expert groups that have been used to make projections. So those high figures are based on those projections. So whether that will happen or not, really, only Allah knows. But the point is that when those projections are made from what prevails elsewhere and what prevailed elsewhere in other countries, in China, how the pattern of the epidemic in China and the current pattern of the pandemic, I think the important thing is to brace for the worst. That is the response. We brace for the worst, so that we strengthen our systems, we train people, we put forward, strategies to be able to deal with that when we get those cases. Certainly, whether Gambia will be able to deal with that or not, our health system is weak. So we pray we don't get 100,000 infections. But when it talks about 100,000 infections, that is the overall number of infections. But not even all those will be symptomatic. You know that they said 80% usually symptomatic. 20% are symptomatic, 80 are asymptomatic. But even with that, it is a huge quantity. Now, the projection also went ahead to say at the peak, if it should reach the peak in the Gambia, we expect 3,000 hospitalizations. That is a huge number. That's a very large number. But in the current scheme of things, we're trying to get as many as 1,000 hospital beds ready just for the emergency. And then, of course, increase the numbers as and when we need them. So they are going to be quickly built. Some are going to be makeshift, but for the time being, we are putting up some permanent structures quickly to be able to deal with that. And we are mobilizing the equipment. The Minister of Finance just mentioned that the equipment are coming very soon. So we are getting prepared. We are not complacent. The fact that we've had 9 cases is not stopping us from strengthening our plans. Now, but we also appeal to the general public not to be complacent. Many countries started that way. They had few cases and they had a quiet period, and then they had the explosion. But because we have a few cases, people think now COVID is not a reality. So we have to be very vigilant and make sure that we continue the strategies, the hand washing, the sensitization will continue, but we urge the general public to intensify their efforts in the preventive strategies. Thank you. Yes, we have a health promotion unit. I guess we've been dealing with them. They are the responsible team. There is a team, a very good team, that are supposed to deal with you regards to communication issues. And I'm sure some of you have gotten their contact numbers, but they should make that available. So if you want information, the correct information, you contact them, they will give you the correct information. I think that is the route of communication. Other than that, you know, it can become questionable. Yeah, thank you.
Question for the
Samate, Doctor.
Oh, okay, so yes, I could be there. Yeah, yes, yeah.
Is yet to arrive in the Gambia, even though the plagues are made worldwide known. May I ask, when is this money arriving? All that is mentioned in the name of the Gambia, when are we going to get it? And the second part of the question is, we know now from our reporting, daily reporting, we realize that people are definitely complaining about food insecurity and fear of being locked down for so long. Now we are talking about state of emergency for 45 days. So what is government doing right now to mitigate the effect that people are complaining about right now? Immediate effect, I mean.
Thank you very much. The monies from the partners, our wish was that it arrived yesterday, not even today. They have a process, and we hope that we will be able to get it ASAP. But again, I said the 47 million is not something that will come in fiscally to us. It is something that will be lodged just for balance of payment support. The 21 million, we hope that by the end of the month we should be able to, because the approval is just, it was just on the 15th. Again, everything is linked to our own good macroeconomic performance. With respect to assisting Gambians, I think this is the responsibility of the government of the Gambia, and data has been gathered. What happened now is the data that we have, the household survey data that we have, this is pre-coronavirus. If we base our distribution to the most vulnerable, this has shifted. Even us in the urban area now, you and I are also vulnerable because it depends on the type of vulnerability. So there is pre-corona and post-corona vulnerability. So the data that we are gathering, it will be based, we have to be guided by a data. That is why the committee, the cabinet committee that is chaired by the Vice President has been working hard, almost 7 days a week, to ensure that the data we gather will be able to guide us in, the distribution. So they were at a very advanced stage, and all the necessary details and information will come to you as soon as we are ready. But the assistance is guaranteed, and we are coming.
Donation coming, money is being offered, some to the government, others to the direct victims. So what is government doing to coordinate this, to all go under one coordination to avoid some people getting more than even those who need it better?
Yeah. I think there is just a few days ago, a project manager, of which it will be announced later, has been appointed to work with the Ministry of Health. We know that there is a lot of activities going on. With us, for government, any donation that is coming will be housed under the custody of the Accountant General. We are not touching that yet because we have not, until we exhaust the 512 million, then we will not go that far, we will not touch that money. In terms of coordination, yes, at the beginning there were little hitches, but as of now, there is very good, effective coordination with our development partners, including the ACSOs and everybody, civil society, and these are things that are going on, and we hope that everybody, it's all inclusive. In terms of coordination now, we are well set and we are moving towards the right direction.
Thank you very much. The lady?
Of finance. As we've seen earlier last week, we've seen you and the Vice President, together with the Vice President and other top government officials, receiving a dummy check of $12 million from AfriCell as their contribution towards the fight against COVID-19. In the video circulating and pictures circulating on social media, you guys did not observe social distancing at all. you guys were seen together, shoulder to shoulder, right next to each other. So what can you tell, or how do you expect Gambians to take the social distancing seriously when you guys are not observing it yourselves?
Thank you. I guess because the Minister of Health was not there to guide us. But on a more serious note, it was a big error, and we accept responsibility, and you will not see that happen again. It was a big error.
Thank you.
I have two questions. The first one goes to the Ministry of Finance. As we have said, for 2 times Gambia, has received money from IMF, and a moratorium also, has been taken for developing countries. And knowing that Gambia, the debt of the country is almost 120%, some say 130% of the GDP. I would like to know your reaction as a finance minister to that. What is, the impact of that one for the country? And the second one, we have always seen in Africa, like our neighbor here in Senegal, they have taken like social measures to help needy, to help the companies that are really affected by this pandemic. And in the country, we are yet to receive that one, and many businesses have closed today. What can you tell them, these needy people today, or the people that are most affected by the pandemic? And also maybe the last question is to the health minister, for the prisoners or inmates. We have seen elsewhere across Africa, and the government are taking measures to release prisoners, in order to avoid any case there in prisons, because we know that if only one case there would be a catastrophic thing. I would like to know maybe any expectation from the Gambian government. If possible, I would like it in Wolof also.
Yeah. Now you are testing me. Okay, thank you very much for clarification. I think this is why we saw the need to be coming to the media. We are not very good at that. We are so much focused on our work. The 129% you were saying, yes, but that is history. We've worked so hard, now it has gone way down to almost 82%. So that is a significant performance, meaning that because of our good macroeconomic performance, I think there is a response from the donors. But let me also clarify, there is a difference between debt relief and debt cancellation. What we have is debt relief, meaning that you don't have to pay your debt now. We will push it maybe in the next 3-5 years. That's what it means. It's not a debt cancellation. So it is something that we welcome and is a big relief. And because of that fiscal space we have, we've been able to mobilize this 512 million so that we can spend it. If we did not have that fiscal space, if it was during the time of 120% to GDP debt, we are tight. But today we are proud and very happy to demonstrate that we are committed, and we are using our own local resources. 512 million in our own local situation is not small money. So because we perform well, because of our fiscal discipline, we're able to really respond immediately to the request for COVID-19. And your other question is about to assure. Yes, the Ministry of Trade and Investment, that is the private sector ministry, they are working very closely with the private sector in order to be able to help the small and medium size, to be able to help all businesses in the Gambia that have been affected. And the package, I'm sure the ministry will recommend a very good package that will ease the pressure on the businesses. Work is ongoing. Yeah, but let me also explain to you that this is a private sector thing. We cannot go overnight to the bank and dictate. We have to review based on the data, based on the justification. Because at the end of the day, the contingent liability rests on government. So when we go to a commercial bank who was making a lot of profit, we cannot dictate. There are policies and regulations that will guide our action. So this is why it needs a very careful, we know the pressure is on, And we know these are the good taxpayers. And we know that if we don't help them, everything will collapse. And we intend in a very positive way to help them. And I must confess now to recognize the contribution from the diaspora. I have been receiving very excellent concept papers and notes from them. And I think this is what we expect from Gambians. You are giving us something that we are now putting together, and I salute them because all the information they are giving us, you cannot find it anywhere in the internet. And that means that trust, that partnership is there. That I must salute those Gambians in the diaspora, even locally, but the diasporans' response, really, I call it their intellectual capital. They have invested, and we salute them for that. mbokk yi li ma mun a wax rek mooy ne bi corona 19 doore fi ba tey jéego yi nga xam ne président Barrow def na ko bari na trop bari na ndiglan lim si itteel mooy li nga xam ne moom lañ soxla si garab ni ma ko mun a waxee rek bañ dooree 512 millions moom lañ teg ne lii pour jënd ay garab ak ay machines yoo xam ne dinañ ko mun a fajee ñi nga xam ne daf leen feebar bi daf leen dab ak ñi nga xam ne feebar bi dabut leen so si yooyu lañ nekk président bi loo xam ne lu déggu la si moom te li nga xam ne tam moo xam ne moo ko war moom as kilifa réew bi moo ngi koo def xaalis boo xam ne jar na ko pour wér gu yarami Gambia moom jaral na ko lu nekk so si tànk boobu la nekk te ñun Minister of Health ak man Minister of Finance digal nañu ne loole mbooleem luñ mun a def loo xam ne dinañ mun a dimbale wérgu yarami Gambie ñi nga xam ne sax ñoom la gën a lifin ñi néew doole ñi ñooñu la ñu dee wax ne ñu bàyyi xel ñu néew doole ñi soo si loolu lañ nekk ñu ñàkk seen liggéey yooyu yëpp mu ne moom Gambie yëpp la ak ñi nga xam ne nekkuñ Gambien sax te ñu ngi fi dëkka ñooñu si njabootam gi lañ bokka soo suy wax su ne Gambien ak ñi nga xam ne ñoo fi dëkka because am na ñoo xam ne dëkk nañ fi ay ñeneen fukki at juróom fukki at seen doom yi fii lañ magee ñooñu doo leen mën a wax ne nekkuñ Gambien soo mbooleem koo xam ne dëkk na fi waaye in particular Gambien si laa wax ñooñu mën nga leen a ooyee Gambien waaye lifin boobu la ñu jox instruction boobu maay ministre baa ngi nii toog amul samedi amul dimanche guddi bëccëg suba daf ñoo woo fan ngeen toolu naka ngeen defee dimbale leen nit ñi dimbale leen ñu néew doole ñu néew doole ñu nag ñi nga xam ne ñu néew doole ñu ngi fii ñu ngi si dex gi fuñ munti nekk rek ñoo xam ne ñooñu la war a njëkkaa nibal bi njëkkaa war a jot mun naa laa wax ne nag sori nañ si lool
Thank you very much. You did mention the issue of the prisoners. Yeah. Yes, an infectious disease in a confined space can spread very widely, affecting a large number of people within a very short period. And the Ministry of Health is aware of that. Discussions have taken place. And the authorities are aware, and they have done preliminary assessment. Not to preempt any action on that, will allow the relevant authorities in that case to answer that question, because irrespective of how good we want to, whatever good we want to do, it has to follow the prescribed procedure. The prisoner issue, also there are procedural matters that need to be followed so that the good thing is done in a right way. So the relevant authorities will talk about those. When you get the chance, you direct the question to them. You get the answer. Thank you very much.
Final question for the day, or three more questions?
Yeah. Okay. According to the female immigration officer, undergoing treatment right now, she was quarantined and then later been released. During her release, she went on her normal businesses. She went to the market. She did her laundry, and also she did anything that she said that she is doing on her normal basis when she was back at the community. So how far are you guys with the tracing of the people that she got contact with?
So the contact team is working very hard and following up, getting the details. Every day they go around to talk to the relevant people, to look at all the possible contacts, and they enlist them and do the relevant actions that take the relevant actions that need to be taken, including lab tests where required. So they are doing what they need to do. But as I mentioned earlier, the last time, you know, with diseases, especially new diseases, people follow protocol of management, and those protocols are designed or developed by expert committees, and the protocols themselves change from time to time based on the new evidence, based on new information, and based on a host of other points, like the way the disease is spreading, which people is it affecting, and so on and so forth. Now, the protocol then was people who had undergone quarantine for 14 days, if they were asymptomatic, they don't show the signs or symptoms, they are allowed to go. But we went further. We said yes, but what about those who are going to stay asymptomatic throughout? Why don't we test them? And when we went ahead, we realized that we did the right thing by testing them. We picked those cases. So I think it was the foresight of the team of the Ministry of Health to even think like that, because that's not even the recommended way other countries are acting in. So it was our foresight. Now, why are some of them, or why are all those people at the treatment center? In other countries too, in some other countries, the protocol is a little different. People like that who are asymptomatic, but they are positive, they ask some of them to stay at home and undergo self-isolation. But you'll agree with me that many of those communities, even before COVID, their lifestyles were different. There were few people in a house and they could easily self-isolate. That is not the case in the Gambia. People live in huge compounds with so many people, and it's very difficult for people to self-isolate. So, and the monitoring, how do you also monitor these people who are under self-isolation and they don't have a thermometer to check their own temperature and so on? So they are better off being in a treatment center where they can get the attention, they can get the monitoring that is required, so that there is an intervention as and when it is required. And equally speaking, protecting the people around them.
Three hands are raised. We start from the right to left. Yeah, you can come in.
My name is Alan, and my question would be about those who were cured and then later released. So in South Korea, like I asked the other time, some people were cured, later released, and then tested later and found out that they were positive. So meaning they can get the virus again. So I don't know what steps your ministry is taking regarding these people who were already released, as to whether you are monitoring them, and okay, what do you tell Gambians? The second one, I want to believe you said during your statement that you want to encourage people to come forward and test. So I don't know what has changed from that statement, and even if that is what you said, what is the procedure? You didn't elaborate on that as to how they can come forward and then be tested. So that too I would want to know. Thank you very much.
Yeah, the first one is with regards to those who have recovered. As I mentioned earlier, COVID-19 is a new disease. A lot is still surfacing with regards to how it manifests. There were discussions with regards to people being immune from reinfection. They get infected, they recover, and they develop immunity from getting infected again. However, some people dispute that. So there has to be enough evidence to guide our practice when it comes to that. So these patients are followed up That is the routine when patients are released from hospital. They are discharged, whatever the condition, they are given follow-up patterns to see the doctors, on regular basis to monitor them. And these people also are undergoing that. Now, the second point was? Yes, the testing, yes. What has changed? Really, we have had stabilization with regards to the numbers. But if you realize that these people who were in the quarantine centers asymptomatic, and when they were followed up and tested, they happened to be positive. So the tendency, the chance for other people to be there who are positive is there. So we want to encourage people to come so that we capture as many people as possible who are positive. That will enhance treatment for those people as and when they need it. But equally speaking, it will also enhance our ability to reduce the transmission. Because when they come forward, they get tested, they are isolated, are given the relevant treatment, they are unlikely to infect more people. That's the rationale.
Okay, let's take the second to last question and final question, and that's it for the day.
kontaan nañ tey am la fii si biir kër bi parce que ministre bi moom saa su ne ñu dal ko ak ay question te question yu bari dafa am ku dem ak finance te dañ la koy bëgg a laajte maa ngi tudd Fatou Samba maa ngi liggéey ak Gambian Talents TV suma question bi moo nekk ndax yéen ñi nga xam ne yéen ay joxe xaalis yéen a ngi gestu ñi nga xam ne ñooy Ministry of Health di seet na xaalis bi fu mu war a duga mu ngi faa duga parce que fan yi gis neen benn audio boo xam ne génn na benn immigration officer moo ko génne di wax ne ñoom fi ñu leen dente foofu dak nekk na place boo xam ne amun fa ndox amun fa li nga xam ne mooy courant te yéen a ngi wax ne yéen a ngi spend xaalis bi si li nga xam ne moo nekk place bi nga xam ne foofu la ñiti di dëkka ma bëggoon a xam rek ndax yéen a ngi def ay gestu su ko defee rek mbir bi réer beneen bi nag mu ngi dem si suñ honorable bi Minister of Health moo nekk question boo xam ne ki nga xam ne moo nekk immigration officer bi bi mu seeni audio bi ñu bëree bëri ñu ngi laajte ndax health yéeguñ dara si li nga xam ne moo xew parce que fi mu nekk it's been 3 days depuis bu loolu xewee waaye dégguñ am anything ngeen wax ko bu dul journaliste yi laajtewuñ leen ko so ma ne xaaral ma laajte leen question boobu beneen bi moo nekk ne ñu bëree bëri ñu ngi laajte am na yenn question yoo xam ne suñ ko posté ñiti si press conference yu mel nii ñeena yi dañuy feel ne dañ koy bëgg a uyu maanaam answer question bi te question bi nekkut ku ñoom bu boobaa rek ñu bëgg a xam kan la ñooy mën a pose suñu ay question jërëjëf.
Okay, jërëjëf sa question about the audio and other thing Haral Director of Health Promotion mooy suñu leader in communication mu answer boobu because you are minister.
Yes. But I'm asking the question
Yes, so,
the minister is
okay.
the health finance minister moo nekk ndax ñoom xaalis bi nga xam ne ñoom ñu ngi koo joxee ñu ngi bàyyi xel bu baax a baax parce que gars yi health mu ne ñoo ñëw ñu ne la lii lañ ko def ndax ñoom ñu ngi def ay gestu xam nga dafa am loo xam ne mooy ñu koy seet ak ceeb
kañ xaalis bi suñ ko joxee nekku ne dañoo jël rek jox ko health bi programme bi dooree minister of health si xelam ak si niñ ko xamee ni mu jubee mu ñëw mu ne ma man day lii day loo xam ne la dafa bari activités yi dañ bari léegi maa ngi laa jox suggestion ne bugga naa sa gars yi ñëw ak suma gars yi so léegi fi ñu nekk nii ñu ngi am benn committee te si biir committee bi am nañ fa internal audit office bi mbooleem loo xam ne request bi ñëw na permanent secretary finance permanent secretary health procurement director general accountant general ki nga xam ne xaalis bi si moom la day nekk xaalis bi doo day nekk ministry of finance ak internal audit bi njëriñam mooy mbooleem loo xam ne dugal nañ ko fa moom mooy war a toppa make sure ne moom am na ay nit fu nekk xaalis bi suñ ko joxee rek nañ ko war a jaayee la ñoo war a jënd yëpp daf koo toppa ndax jënd nañ ko ak naka lañ ko jëndee ak naka lañ ko joxee si biir loolu soo nekku ne xaalis bi dañ jee jël rek ñu jox ko dafa am committee boo xam ne bor bu set technical committee ñoom ñooy seet xaalis bi ñoo joxe ñi ko request te doo request ak ñu jox la dañ koo seet su fekkee ne dafa bari ñu wàññi ko ba pare dinañ dem si marché bi seet ndax yow li ñoo wax ne moom ngaa jënda ndax loolu mooy prix bi soo looloo nga fa duñu loo xam ne dañ koy topp bu baax a baax.
ndax yéen yëg ngeen audio bi tey def ngeen gëstu ndax ñooñu suñu dëkk am na ndox ndax amul ndox ndax am na courant ndax amul courant.
xam nga loolu suñ ko waxee directeur bi ak ministry bi nga xam ne moo responsible loolu seen liggéey la pour ñoom ñu dem ñu investigate dañu ñëw ñu report si ñun loolu mooy mbir bi ku nekk rek non waaw.
Yeah, thank you very much. My question was, what was it? No, let me answer the question. No, not the audio. He has something he wanted to say for the health. Yeah. Salah to be one lan la one. Was it audio bi? Okay, mom did not want to affair audio bi. Wante lunga large Minister of Health. Mantawin na la kasi all of. It may not be as good as Minister. Wante nunga waxe ni ndax xaalis buñ dee joxe Ministry of Health ñu ko monitor Ministry of Health mun nañ ko use nu war sa use foog naa question boobu warloo ko woon a tegee noonu but anyway comme que noonu la ñëwee nañ ko tontu noonu Ministry of Health ñu am dignity ñoo fa nekk place liggéeykaay bu nekk di nga gis ñoo xam ne dinañ bëgg a undermine système bi dinañ def loo xam ne o dinañ attempt def loo xam ne jaaruta yoon wante ñu nekk si ñu elif Ministry of Health incha allah duñ nangu loolu Ministry of Health dafa am robust système système bu la Ministry of Finance wax léegi nii système boobu waxuma ne musuta am fii si government wante bariwut su amoon moom dina si am expérience wante bariwut lu tax ma ne bariwut nga am loo xam ne government def ko declare pour ministry boobu jëlee ko respond jëlee ko def lu mu war a def nga am ku elif ministry boobu noonu dem si counterpart am bi Ministry of Finance ne ko nañ toog lii dafa involve activities yu bari nañ form committee yoo xam ne Ministry of Finance dañ fa am representation Ministry of Health am representation so committee boobu ministre bi neem na ko fi mu ngi am permanent secretary Ministry of Finance ak teamam bi accountant general under Ministry of Finance ak teamam bi director of internal audit Director General Gambia Public Procurement Authority ñoo di approve any procurement in this country that is made by the government. Then nga am permanent secretary Ministry of Health ak teamam bi so di nga gis ne request bu ñëw ñi ñoo dee toog whether request for whatever payment whether request for procurement ñi ñoo dee toog hours and hours almost every day to scrutinize every procurement every expenditure before it is implemented moo tax ma ne la fooguma ne lii su dee am na bariwut this is the strategy we put in place wante the other thing loo xam ne wax nañ ko ay yoon a yoon xaalis bi is not with Ministry of Health wax nañ leen Ministry of Health is not the custodian of government money xaalis bi Minister of Finance def ko dee yónni Ministry of Finance dañ ko dee yónni to an account in the central bank and the account holder is the accountant general so any disbursement def dee dem si account boobu is called a special projects account ku dee sign check boobu noonu kenn nekkul Ministry of Health bu dee sign check boobu ma yegal leen ko ku ko dee sign mooy accountant general I think this need to be clear xaalis yii nii ñëwuñ si Ministry of Health suñ gaay Ministry of Health suñ amee request def dee jaar si permanent secretary bi def ko approve ne this request is good enough for the ministry is one of the activities then ñu yóbbu ko si committee bi scrutinize ko léegi-léegi ñu reject ko in fact am na request yu bari yoo xam ne gars yi reject nañ ko and dañ leen jox liberty boobu pour gars yi mun a reject request yi so there is a very robust system and very soon we will be publishing the expenditure buñ def rek Minister of Finance ak suñ gars yi dinañ toog on regular basis whether dina nekk weekly or fortnightly ñu ko publish ñëpp di ko gis so it is I think this is unique and we pride ourselves in that thank you very much
jërëjëf Fat Samba laajte boobu nga laajte noonu audio bi déglu naa ko ba mu jeex kooku na dëgg li mu wax si audio bi moom loolu la xalaat loolu la wax waaw lu ñu war a leeral nit ñi ne mooy moom mu ne bu ñu ñëwee gars yi health ñoo lay yóbbu Manduwaar xanaa loolu la wax si audio bi xanaa déglu nga ko waaye ñoom health ñu jéguñ bu ñoo dem Manduwaar security nekku na dañ nekk si under health security is under security health staff are under health so bu ñu ñëwee security ñoo leen handul ba after PS moo dem jël gars yi PS jeete ak director public health services ñoo leen jël leen Manduwaar isi leen Bamboo Beach mu ne tamit si audio bi ñoom seven ñoo de nekk benn room Bamboo Beach benn room lag la ku nekk ak sa benn room sa air condition sa télévision sa fridge loo fa sola yow kenn yaa ko moom te room was foo clean man maa fa woon sax bu ñëw loolu dafa war a leer te dañ ko war a xam te su booba tam mu ne tam am na ñoo xam ne dañ leen génne soldat yi yóbbu leen Badala Park dañ bëgg a leeral nit ñi ne kenn demul Badala Park si security officers yooyu ñoom yëpp bu ñu ñëwee dañoo yóbbu Bamboo Beach foofu lañ nekk te ku nekk dañ nekk seen bind gi boppa te lekk bi manqué wut dara manqué wut leen te psychosocial support am nañ ko am nañ service bu nekk bu ñu war a am nañ ko loolu dañ ko bëgg a leeral nit ñi li mu wax si audio bi loolu mooy xalaatam waaye li am loolu la ñoo wax nit ñi loolu laa bëgg a wax jërëjëf. yaa yëg nañ ko liñ bañ mooy fu mu nekk ne dañ ko bëggoon a wax fi tey waaye li xew mooy dañoo toog ñu seet suñu waxtaan li ñu war a waxtaan ak nit ñi parce que liñ bañ mooy ñu wax loo xam ne ëllëg ñu wax lii ëllëg tamit leneen ñëw dañ dee bëgg su ñoo génne si nit ñi ñu paquet suñu information ba mu correct ñu génne suñu waxee rek kenn du si am benn sikk loolu moo tax so fu mu nekk ne yëg nañ ko te ñu brief naa ñu war a ne dañ ko war a binda te ñu war a xam ne ñu war a leeral boobu waaye bu audio bi am nañ ko déglu nañ ko man su booba démb laa ko soog a déglu te démb lañ commencé di xalaat sa lan lañ war a tontu loolu te yàlla def laajte nga ko tey te dañ ko bëgg a leeral nit ñi ne li mu wax ci audio bi loolu amul si wàllu ministre of health jërëjëf.
jërëjëf directeur mun naa confirm sa wax loolu ñun tamit keroog dem nañu no Bamboo Beach I was a witness time gaa ngi distribute supply lu jigéen bugga rek gaa ngi ko nekk di ko supply live so that is true and final question for the day and before we move to the final you want to ask on his behalf oh okay one question and then we move to the next agenda about the mask. Okay. It's okay. All right. Thank you very much. And I hand over to the Director of Health Promotion for the next item on the agenda, which is the issue of masks.
Okay. Thank you. You know, the Honorable Minister is promoting the use of mask, which he has in his office. So he will demonstrate and then showing people what we should do. So, Honorable.
Yeah. Yeah. Well, of course, the hands need to be cleaned when we sanitize. Yeah. So otherwise, the mask itself will be contaminated with the unclean hands, and that becomes very dangerous. The hand is not clean. We touch part of the mask that needs to go to the nose and the mouth, then Aniko silatina jala komodo. Come on, just a little. Okay, yeah. Yeah. Okay. Good. Yes, it's very important. Yeah. So, well, this is locally made mask, really. So we can get this done, right? This is locally made, and we think it's useful. People can get it used, locally made. Yeah. So locally made and. Yeah. So we recommend the use of this when we go into public places, and then we make sure that it is kept clean, it is washed regularly, and when we handle it, the part that comes in contact with our nose and our mouth, we make sure that we don't handle those parts. So at this juncture, we'll supply you with, this is locally made, so but we have some surgical ones that we want to give to you in our campaign to kickstart the encouragement of everybody who's going, anyone who's going outdoors to put on mask. Thank you very much. Thank you.
Jërëjëf comme que tayri akino design nekkun di ñawal asobi pour gente yi ak lifini mun ngeen nekk di ñawal ñi ni locally made mask. Jërëjëf surtout.
Yes, thank you very much.